Good afternoon. Welcome to the Case Management and Provider webinar. We are glad to be with you today. I am Holly Wimsatt. I have the privilege of serving as the Director of the Bureau of Disability Services. And again, just want to thank you in advance for sharing some of your afternoon with us. So the first thing you see is what I hope you always see when we first meet, and that is the DDRS core value that all people are empowered to live, love, work, learn, play, and pursue their dreams. So as we move through our presentation today, we will have some items shared in the Q&A. I'm looking, they might already be there. But we will be sharing some, yes, there they are, some announcements and some links in our Q&A section today. On the right of your screen, if you would like to sign up for announcements, we will have that link there as well. All right, before we get started, I want to talk a little bit about how to use live captions. So to turn on live captions and subtitles, select Caption Subtitles on in your video controls. Change the caption language to whatever language you want by selecting Settings, Caption Subtitles, and then make your choice. If you have a question, select the Q&A on the right side of your screen. Again, you'll probably want to open that up anyway because we're putting links in there that will be of support to you and your work. So select that Q&A and type your question in the compose box, and then you'll need to hit send. And then your questions will be visible to presenters, and we will answer them as time permits. We do have a lot to cover today, but any questions that we get, we can include in the next webinar as well, because we are still doing these monthly. So today, we are going to provide an update for all BEADS providers. Then we'll provide some updates specific to case managers and providers on the health and wellness and traumatic brain injury waivers. And then we will provide some updates to case managers and providers on the community integration and habilitation and family support waivers. Then we'll do some review some questions and answers from March. We're also incorporating some other questions, and you'll see this happen periodically that maybe we receive through our helpline, our BEADS help, or other avenues where we think it would be helpful to provide some clarification. So, and then we will do what we usually do and ask you to tell us what you'd like to hear about in future webinars. All right, so an update for all our providers that we had the privilege to work with. Reminder about home and community-based services settings rule and lease agreements. So we've talked about this a lot, but it's important. So know that you'll hear this again and again. The HCBS settings rule or final settings rule includes additional requirements for those settings that are provider owned or controlled. We sometimes call them POCOs because we need another acronym. One of those requirements is that the individual have a lease or other legally enforceable agreement. The lease or legally enforceable agreement should have the same responsibilities and protections that tenants have under landlord-tenant laws. So what this means is that landlords, or the provider, I should say, should not move in housemates without the knowledge and approval of the individual who has a signed lease or residency or tenant agreement. The provider should not establish house rules that modify certain rights of the individual's home and what they want to happen in their home. That includes providers establishing rules on when visitors can come or when quiet hours are or anything like that. And then we also, providers and teams should not limit the individual's right to choose a new provider, as the lease should never be tied to services. We really can't stress that enough. Individuals, when they have that legally enforceable agreement, which is required in the world of HCBS, their services cannot be connected to that lease or enforceable agreement, if you will. Some important reminders about incident reporting. Any initial incident report must include a comprehensive description of the incident, a description of the circumstances and activities occurring immediately prior to the incident, a description of any injuries sustained during the incident, a description of both the immediate actions that were taken as well as actions that are planned but not yet implemented, and then a listing of each person involved in the incident. So first name, last initial, description of their role. So for example, is it a housemate? Is it a staff member? Is it a BC, for example? And then the staff title, if it is indeed a staff person, if indeed a staff person was involved in the incident. Additionally, the report of the incident should ensure that that report contains clear and good information, clear information that meets the basic expectations for content. Also need to be sure that there is HIPAA compliance in that incident report if there's other, for example, housemates involved. So case managers and providers, all of you, all of our partners, at times complete incident reports. So what we ask is to ensure that those quality incident reports are submitted. The general content, there are 2 standards of information, or 2 categories of information. The general content that must be a part of every incident report, and then the actual incident related details. So an incident report should contain enough information to fully explain the who, what, when, where, why, and how. And this should be done as succinctly as possible without overwhelming the reader with unnecessary or unclear details. Additionally, including all the necessary details does reduce the necessity of having follow-up reports in some situations. However, if there are follow-up questions, it is very important that those be addressed within the specified time frame, along with any requested documentation. So we all have the same goal of those incident reports, right? To ensure that when there is an incident or a problematic situation, it is reported and that there is the appropriate follow-up. So please just make sure that you're including those details, or training your staff to ensure that those details are addressed. Right. Case management coordination. So again, I think we have talked about this as well, but as we know, individuals and services may transition from one waiver to another for a variety of reasons. We won't go into all the reasons, but the important part is that we want to ensure that there is no gap in services. And that requires some really strong coordination by the case manager, or case managers, I should say. So as an example, if we have someone on the health and wellness waiver transitioning to the family support waiver, the case manager for the health and wellness waiver and the case manager for the family support waiver need to be in communication. There needs to be coordination of the prospective waiver end dates and waiver start date. We cannot, the system actually won't allow multiple waivers to be active at one time, but we don't want to test that in the system, right? Individuals can only be on one waiver at a time. So it's that coordination between case managers is key to make sure that there is not a gap there. That communication can look lots of different ways. That can be email, that can be phone call, that can be team meetings, joint team meetings, which would be encouraged as well, so that those communication lines are open. You can coordinate with the BEADS office when applicable, our local district offices, and certainly reach out to us if you have any questions. We know every situation is not the same, and we are happy to support providers and case managers, and most importantly, individuals when they're transitioning from one of our waivers to another. We have a brief slide here about home and community-based services waiver marketing. So as a reminder, for all HCBS waiver providers that under 42 USC, I'm not going to read the citation, you can see that, it is illegal to knowingly or willfully offer or pay any remuneration directly or indirectly, overtly or covertly, in cash or in kind to any person to induce such person to refer an individual to a person for the furnishing or arranging of the furnishing of any item or service for which payment may be made in whole or in part under a federal health program. Okay. I think that's pretty self-explanatory, but just know that that is a requirement that is in code, and we all do need to observe that at all times. All right, want to talk briefly about waiver consolidation. So this is referencing the movement of the health and wellness and TBI waiver functionality in CAMS to the BEADS portal. So our mission at BEADS, and most of you have probably seen this before, is to connect people with disabilities and their families to the resources and supports to live their best life. One of the ways that we try to do that, or one of the methods that we use in that effort, is to do our very best to ensure that our IT systems are modernized as much as possible and support communication and collaboration within teams and individuals, being that very important person on teams, right? So we continue to look at how we can make technology work for us. And when I say us, I mean the service system. So in July, the waiver consolidation project, or that moving of that functionality, the health and wellness waiver and the TBI waiver will be moved into the BEADS technology system, which is the BEADS portal. That system currently is the case management IT system for the community integration and habilitation and the family supports waiver. So we're able to leverage a lot of that functionality. The resources and trainings and other supporting materials have been developed, and we have training in mid-June. If you have not seen that announcement, you should see it very soon. And we would encourage all case managers to sign up for that. We think this will be an improvement over our current situation with the health and wellness and TBI waivers, again, because we're able to leverage some of that existing functionality in the BEADS portal. And as a longer term matter, BEADS continues to work on how to consolidate all the different IT systems that BEADS uses, state systems, into one, where we can, make it more efficient for our external partners like case managers and providers and individuals and families, but also streamline it for our own staff and personnel. All right, so we wanted to also provide some information regarding Gainwell's activities around purging inactive user accounts on the IHCP portal. So as part of our ongoing commitment to maintaining a secure and efficient provider portal platform, Gainwell Technologies is initiating a cleanup of IHCP provider healthcare portal user accounts that have not been accessed in 2 years. So that's 2 years if an account hasn't been used. All individuals who previously had portal user accounts that have not been accessed since June 1st of 2023 will be removed on June 1st, 2025. So that's coming up very quickly. That's Saturday, I do believe. If there is a future need for these users to access their IHCP portal, they'll need to re-register their account on the provider portal. Now, we have included here on the slide, and we will post this information, where you can send direct questions. Those direct questions would go to the electronic data interchange technical assistance line at 800-457-4584, option 3, or you can email, I'm not going to read the email address. You can email and ask about that if you have any questions or need some additional information on that. So the 2025 IHCP Provider Communication Survey, want to talk about that. To help with evaluating provider outreach efforts, the IHCP is requesting providers' feedback on our IHCP communications and events over the past year. Providers may complete the online survey through June 13th. So if you have not done so, and again, we have the link here. If you have not done so and you want to complete the survey, we would really appreciate it. This is your chance to be heard, but you must do that through between now and through June 13th. It's important to note that all answers will be kept anonymous, and the IHCP will use providers' feedback to plan and improve future communication and events, including IHCP live webinars, the IHCP Roadshow, and the IHCP Work Seminar. So your time in helping us create a better experience for all is greatly appreciated. So please, again, please, take the time to complete the survey. It's not terribly long, and we definitely want to hear from you. Okay, let's talk a little bit about claim submission documentation. So IHCP, this is a reminder from IHCP that providers, that only the required documentation needed for a claim to adjudicate should be submitted as claims attachments. We have some examples of things, documents that should not be sent as claim attachments. Copies of credit card information, we don't need that. And frankly, don't want to have that information. Driver's license, checks, or any documentation with protected health information or PHI related to other members. If you need more information about submitting claim attachments, you can see the claim submission and processing provider reference module. Again, it is linked here. Please check that out if you have questions about how you submit those claim attachments and what claim attachments you should attach. All right, I'm going to switch gears for a minute want to talk about the online HCBS waitlist portal. So FSSA has launched a new online resource for individuals and families to confirm an individual's waiting list placement for the Health and Wellness, Pathways, and Family Supports Waiver. The online waitlist dashboard is available at, I believe we have that in the Q&A. Yep, there it is. So you can see that there, or access it at the link in the Q&A. This is what you will see when you log on. We are working to update that name. I do want to explain it was previously called the BEADS Waitlist Portal because this was the area where individuals and families could go to inquire about a person's placement on the Family Support Waiver waitlist. So we are working to update the language on the website. In any case, this resource provides an opportunity for the individual, family members, or advocates to confirm the individual has been added to the wait list and to verify the accuracy of the individual's contact information. If there are the person seeking this information has additional questions or needs to correct the contact information, that can be done from this site. There is also a guide linked on the site that you can see here that will walk you through the functionality and how this works. I do want to note, if you are a provider, let's say of non-waiver services, and you are supporting an individual and you want to, the individual wants to know if they are on the wait list, for example, for the Health and Wellness Waiver or the Pathways Waiver. As a provider of non-waiver services with the person's permission, and if you have all the necessary information, and if we can flip to the next screen, we'll talk through what that needed information is. You will be able to look and inform that person, or let that person know that yes, you are on the wait list. So to access, as I mentioned, this information through this site, the requester must submit certain key point pieces of information into the search to gain access to the information. Requester will need the following: the last 4 digits of the individual's Social Security number or the individual's Medicaid ID or RID, and the individual's first name, last name, and date of birth. So essentially 4 specific identifiers. If a person believes to be on the wait list, but their name doesn't show up, they should first double click, do it again, make sure that you didn't have, an incorrect spelling or transposed numbers. And then if you're still having issues as a requester, you can contact the help desk again by clicking a link on the screen. We are very excited to be able to make this HCBS waitlist portal available in the spirit of transparency, so that individuals and interested parties who need that information have the necessary information to check, can see and verify that someone is indeed on the wait list. So very glad to have that rolled out and available. All right, we have some provider updates for the health and wellness and traumatic brain injury waivers. First, we want to clarify, we've had quite a few questions about structured family caregiving on the health and wellness waiver recently, and just want to clarify that the provider agency must conduct at a minimum 2 quarterly home visits, and those visits must be conducted in the home. Additional home visits, ongoing communication with the principal caregiver is based on the assessed need of the participant and the principal caregiver. So the 2 quarterly home visits is a minimum. If an individual needs more than that, then so be it, that can be provided. But the 2 quarterly home visits in the home is the minimum. Home visits are conducted, let's go back, please, by a registered nurse and or a caregiver coach as determined by the person's service plan. So yes, it could be a registered nurse or a caregiver coach. But again, those visits must be conducted in the home. Next slide, please. Okay, level of care assessment representative vendor. So we've talked about this before too, and we are very, very close to implementation of the level of care assessment representative as it relates to home and community-based services. So we have a go live implementation date of July 1st, which is just 5 weeks away. This, as a reminder, the level of care assessment representative is that statewide entity that will be completing assessments for nursing facility level of care for purposes of home and community-based services and issuing those determinations as of July 1st. This LCAR vendor is Maximus, as we've talked about. Maximus is currently and has been in Indiana for years, completing nursing facility level of care assessments, among other things, for Indiana's pre-admission screening and resident review program, or PASSR program. So Maximus has been and continues to complete nursing facility level of care assessments for individuals seeking nursing facility placement. July 1st, they'll start those nursing facility level of care assessments for those home and community-based service waivers that require that. Pathways for aging and the health and wellness, and sometimes the traumatic brain injury waiver. So with that July 1st deadline, or go live date, just 5 weeks away, be on the lookout for continued communication and regular updates regarding implementation and timelines, webinars and comprehensive overviews designed to provide information and resources leading up to the implementation, and then training materials and resources to support you, our partners and stakeholders with the transition. Some of these opportunities are here. There's provider support and resources, and you will see it's very small. On the left are dates. In the center column are titles of the webinars, and on the right is the presenters, the presenting entities. So on the 6th, we'll have an overview for providers. We'll have an overview for case managers on the 9th. We'll do some internal overviews on the 10th. On the 17th, there will be BEADS portal training and a demo. On the 18th, there will be some internal training, and then again, some portal training on June 18th. So these are state hosted or presented opportunities. So be on the lookout for those announcements around this. Next slide. Now this list, which is even smaller, so our apologies, is a list of provider support and resources generated by Maximus, the vendor. So as you can see, they have additional trainings around the launch of the level of care assessment representative. I won't read through all these, but you can see that it is pretty extensive. June is very much a training month, in a month where we anticipate working closely with our partners, gearing up, answering questions, addressing any concerns. So just know you'll continue to see more communication and training dates issued. Next slide. There are also online resources at nlcar.com. That is a Maximus site. There is also a clinical services site by Maximus. And then we also, I hope it's in the chat, have a state landing page as well. So please know that there are resources out there to support you as we move through the launch of the level of care assessment representative. Now there are, this is specifically for case managers here. We have assessments under the health and wellness waiver that are currently overdue or due prior to July 1st of 2025. Because we are moving that functionality from the CAMS to the BEADS portal, those levels of care must be completed, finalized, and submitted absolutely no later than June 20th. So if you are late on completion of a level of care assessment, please give that your full attention. You will, if you haven't already, receive an outreach from us on anything late, but also please look forward to those levels of care due before June 30th, and let's go ahead and proceed with getting those completed as well. All late and pending nursing facility level of care reassessments that remain incomplete, and then any upcoming reassessments that are due between now and June 30th. So again, we need those completed on June 20th. The CAM system and the BEADS portal will go down temporarily on June 26th. So the June 20th date is to give us time to review anything we need to review and to assess anything that might be outstanding before the cut over. So again, please ensure that assessments are entered into CAMS and that all documentation is accurate and complete. We appreciate your assistance with this. We know sometimes that there's difficulty given some individual situations with getting those scheduled and completed, but we ask that you give that a lot of focused attention here in the next 5 weeks or 4 weeks actually, to ensure that we get that those assessments completed and in the system for the cut over to the new to the BEADS portal. Next slide. All right, speaking of level of care, so we have, as you know, been working towards implementation of some additional tools from the interRAI suite of tools that for determining nursing facility level of care. So as a reminder, today, the assessment tool used to determine nursing facility level of care is called the interRAI home care tool. That tool was designed for adults. So we announced, long time ago. I believe it was actually in early 2024 that we would be implementing some tools specifically for youth to assess youth for nursing facility level of care, as well as using new assessment tools that not just would help with that nursing facility level of care determination, but also help us in case managers and service planning for youth. So again, today, the tool used for nursing facility level of care is the interRAI home care tool. July 1st, we will be implementing the interRAI early years tool for children 0 through 3 years of age, and then the interRAI pediatric home care tool for individuals 4 to 17. And then the 18 plus will continue, or adults will continue to be assessed using the interRAI home care tool. Again, not new information, but just wanted to clarify. or remind that this is happening. There are trainings scheduled. There will be more trainings scheduled as well. But we do recognize that the early years in pediatric assessment tools are unique to the health and wellness and sometimes the traumatic brain injury waiver. Next slide. So again, this ensures a consistent and standardized assessment tool to better support assessing children. And they will be used in the health and wellness and the traumatic brain injury waiver when the individual seeking the traumatic brain injury waiver is seeking nursing facility level of care. July 1 is our implementation date. Maximus, the LCAR vendor, is ready to implement use of these tools. All right. Want to just add a reminder that currently the health and wellness, traumatic brain injury, and pathways for aging waivers are at CMS. The amendments for an implementation date of July 1st. We anticipate hearing back from them very soon. Again, these amendments have a planned effective date of July 1st. They were out for public comment some time ago and are currently just under review by CMS. So as soon as we hear from CMS, we will share with you, but just wanted to provide that update. All right, now we're going to move to provider updates for the community integration, habilitation, and family supports waivers. So this is a reminder about the PCISP, or the Person-Centered Individualized Support Plan. When there is a change of service provider on an active PCISP, case managers must obtain utilization from the outgoing provider and inform the incoming provider what is remaining on the plan. This is especially important for life of plan services like behavior support services and respite, among others, as there's often instances of the original provider utilizing most or all of its authorized units, which presents an issue for the incoming provider if they're not aware of the remaining available units. So we want to make sure that there is an accounting when there is a change in providers of what has already been provided and essentially utilized out of that those units on that PCISP. Case management orgs must ensure that all case managers are trained on this and complete utilization requests before an active PCISP is updated and submitted to BEADS. The PCISP service units also need to be updated in a timely manner. There are times when units are reduced or removed from a PCISP after the dates of service have passed. If that's done, case manager needs to make sure those weren't utilized because a provider may have already provided the original authorized units and or billed for them. So it's very important that case managers communicate with providers that are outgoing or going off of the PCISP to gather that information. And it's important as the outgoing provider that you provide that information to case managers. At the end of the day, we all want to ensure that the individuals have the services they need and that the individuals have an understanding of what is still available on those life of plan services. Okay, we talked briefly about the waiver amendments that are at CMS. We also have waiver renewals that are at our federal partners under their review. We submitted renewals for the family support and the community integration habilitation waivers as well. shortly after, about 2 weeks after we submitted the amendments for the health and wellness, traumatic brain injury, and pathways waivers. So those renewals are also with CMS under review with a planned effective date. And I'm sorry, it is July 16th, I believe, and not the 1st. Again, we expect to hear back soon on those as well. But we currently have a number of items with our federal partners under their review. Okay, this should look very, very, very familiar to providers of services on the health and well, or on the community integration, habilitation, and the family supports waiver. So a provider system administrator must log into the BEADS portal and confirm the provider profile information at a minimum of every 90 days. All CIH and FS waiver providers are responsible for ensuring their provider profile remains accurate, and the provider attestation is a simple, effective way to do so. The provider profile information should be updated anytime there is a change in the provider profile information. I will also note and remind there is an area in the provider profile where a provider can include some text talking about their agency and their strengths. We heard you many years ago, providers, that this is something you wanted to be able to do. So we've made that happen. We now need your assistance in completing those provider attestations. This is a measure we report to CMS, and we are not near where we need to be on that measure. We, a few months back, we modified that choice list a little bit to indicate to individuals and families that received those choice lists when that information was last updated by providers. We saw a little bit of a bump in provider completion of those attestations, but have not seen that be sustained. So we will be exploring other ways to ensure those provider attestations are completed in a timely manner. You can help by ensuring that your identified individual or personnel at your agency completes that attestation every 90 days. You can do it more often if you like, that's fine. There's no limit on that, but we have to have it completed or reviewed every 90 days. Okay, behavior support services. So an individual on the community integration, habilitation, or family support waiver can only have one behavior support provider basic and one behavior support provider level 1 provider at a time. Okay, this can be the same provider for both or different providers, but there cannot be more than one of either the BMGO or the BG110. This is current state. Concurrent service delivery of behavior support services with other approved Medicaid services means providing behavioral support services and another distinct separate waiver service, which would of course be one that is not similar in nature, does not have a similar purpose, and does not promote similar outcomes to the behavior support services at the same time. Additionally, services provided to an individual by a behavior clinician cannot be administered virtually in the current environment. Ooh, all right. So we are now, that was a lot of information. We are now at our kind of monthly Q&A section. These are questions that we received in March. So let's roll through these. Service plan reviews are taking several weeks for approval, which is leaving people without services. As a case manager, what should I do? So this is referencing specifically the health and wellness and traumatic brain injury waivers. So service plans will go into extension, which will allow for the individual to continue to receive their personal care services without interruption. Case managers should ensure that the provider is aware and has the updated NOA that shows the approval for the month. As a reminder, case managers, we ask for your assistance in receiving all information necessary and responding when you submit that service plan, and also responding to RFIs quickly and thoroughly. We know there is, we have a number of them, and it is taking us some time to get those all reviewed and returned. So anything you can do to help ensure that what you submit is comprehensive, we would appreciate it. Know that we are working diligently every day to address those service plans, waiting for review. And again, please make sure the whole reason that extension service plans are a feature and have been a feature for many, 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 many years, is so that there would be no gap in service if there was something that caused a service plan or a level of care to be late. So please make sure providers have the NOA for the extension so that they can continue to provide services. Next slide. Okay, you advised during the last webinar that assigned choice pick list is required. Is this required when an individual tells the case manager that they want to change providers? Absolutely. So a signed choice or pick list is required anytime there is a change in a waiver service provider. As you know, HCBS services, the cornerstone of those services is choice, individual choice of services and individual choice of providers of those services. So, and that is all within, of course, the confines of the waiver itself. But absolutely a signed pick list or choice list is required and should be uploaded to the appropriate system. Today, for health and wellness and traumatic brain injury, that is CAMS. July 1st, that will be the BEADS portal, and you will, case managers will receive training on how to do that. But those choice lists are key. They need to be uploaded and they need to be signed. I believe we did talk about not uploading perhaps the full pick list because some of those pick lists are very, very long that come out of CAMS. But ultimately, we need some kind of documentation or that documentation in our system, accessible by the state, as documentation that the person made that choice. I am a provider. How do I register for the online HCBS waitlist dashboard to confirm an individual's waiting list place for the health and wellness pathways and family supports waiver? So great question. I think we answered that, but we'll talk a little bit more about it. As long as the provider has permission from the individual or their legal rep and the necessary information, a representative of a provider, for example, may complete the search in the online dashboard. It doesn't require a specific registration or login. And that is really because we want individuals and families to be able to search themselves if they want to or if they choose to. So there isn't a specific login or registration to be able to use that dashboard. But that's a good question. All right. We are, looks like we are at the end. We do want to, again, offer to you to tell us what you want to hear about in our June webinar. Obviously, we'll probably be talking about LCAR and providing an update on the waiver amendments and the waiver renewals that are currently at CMS. But certainly if there are other topics you would like to hear about, let us know. And we would like to, we value you and your time, and we want to make sure that the information we're providing is of use to you and supporting you in your work. So please feel free to share any and all ideas with us. And I believe we have a lot of comments and questions. So I'll just dive in here. There is a question. We have received responses from providers that APS no longer exists. When asked if they made a referral, will new contact information be available? Yes, and APS does exist. It continues to exist as it has for a number of years in the local prosecutors' offices. July 1st, there is a new vendor that will be providing those adult protective services on July 1st and after. If this is a topic you would like to hear more about, I'm thinking, Richard, let's add that to the list for June. And perhaps we can get our friends from Division of Aging to present, or even provide some information for us to share. That's a great call out. Thank you to the person who submitted that. We have a question about referencing housemate names in incident reports. We have historically not included a housemate's name in someone else's incident report to maintain confidentiality. We may use initials in these cases as an identifier. Is that no longer appropriate? No, I think that's fine. Initials or the what we call the HIPAA name. What we don't want is a lot of identifying information in the incident report, but you can certainly use initials of a housemate. That would be fine.
Holly, would it be helpful if I pulled out some questions for you, as I've been trying to answer some along the way?
Oh, yes, that would be great. Thank you. Thank you. Yes, that would be great, Heather. Thank you.
Yeah, so there is a question that came in around the pick list and just clarifying the full pick list being uploaded. Apparently they've been told in the past they need to upload to prove that all providers had an equal opportunity to be chosen. Mm-hmm. And so they just want to ensure that the direction now is it doesn't have to be the entire choice list, but just the one that is signed with the chosen provider.
Yeah, we actually have talked about that a number of times, and my understanding is that pick list coming out of CAMS can be upwards of 80 pages for one service. So that's a lot. We recognize that. I think what we would look for is the case manager to document that the full pick list was provided, and then upload, ideally it would be the whole thing. But again, we recognize that space is an issue, particularly in CAMS. So if you just want to upload, the signature page, if that pick list is 80 pages. Now, if you run a pick list for, let's say, case management, and it's 6 pages, then upload the whole thing. But if we're talking about 80 pages, which is what I've been told in previous webinars, that's significantly different than, an 8 or 10 page document. So we're okay if you don't upload an 80 page document, but you do need to document that you provided the full pick list. If it's a 8 to 10 pager, that's fine. Upload the whole thing. That's no different than a lot of other documents we upload today.
Okay. There is some questions around the waiver wait list. This one in particular says, for any clients we have who may have experienced a waiver lapse due to a Medicaid lapse from needing redetermination paperwork turned in, we've been able to assist them in waiver restarts or waiver re-entries without them needing to be put back on the wait list once their Medicaid is restored. This individual has been told that as of July 1st, it's possible that all waiver restarts will be waitlisted rather than being able to be restarted within a few weeks of their Medicaid health coverage being reinstated. Is this true?
Yeah, so I think, Richard, let's put this on for the next webinar because I think there's some specifics we need to cover there. So without having a whole lot of details, I don't want to speak in generalities, but that's a good question. There are certainly timelines around reentry. And the key here is in the example you just gave is the Medicaid eligibility. So as case managers or providers, any support you can provide to individuals and families around their Medicaid redetermination and stressing to them how important it is to make sure that they're following up timely on all the Medicaid requested information. And I'm not saying that families don't. I'm saying anything you can do to help support them in getting that through before there's a lapse in their coverage, that can only benefit the person. So please help them with that. There are specific timelines, though, for individuals out of services. So we will provide some additional guidance around that. There is guidance available as well, but we'll provide something in the next webinar. If it's in the same waiver year, that individual, and if they were active in that waiver year and there's a lapse and they're still in that waiver year, they should be able to resume by and large. They should be able to re-enter that waiver. But again, we'll take that back and incorporate some information next month for clarity.
Thanks, Holly. I think we might have time for maybe one or two more questions.
Okay.
One is, if CMS doesn't approve the amendments, does Maximus still take over?
Well, we don't anticipate that the amendments won't be approved. We anticipate those will be approved with a July 1 effective date. So, yeah, so we don't have any concerns regarding that. We have been in communication with CMS.
And maybe one last question. Some of our CIH and FSW providers are inquiring about the DSP training registry. Mm-hmm. And if that takes effect July 1, and will they be receiving information about that?
Yes, we will be getting information out about the DSP training and registry. Again, another great topic. You all are giving us all kinds of topics for next month. So thank you. We will include some information on that in our next webinar as well. And that does just today or right now apply to the family support and the community integration habilitation waivers.
Okay, I think that's about all we have time for. There are a large number of questions. I have attempted to answer some of those, but again, we will review those and maybe add them in the next webinar as well as a follow-up.
Thank you all. Thank you, Heather, for your assistance, and Richard, you as well. And thank you, attendees. We had a lot today. We got over 300. Over 350 actually, so that's great. You know, please feel free to reach out if you have questions or other suggestions for the next webinar. But we've got some great ideas from you today. So thanks so much, and have a great rest of your week.